Hey guys, welcome back to patient assessment. We're going to move into history taking. So what is a history? When you think about history, history is things that have happened in the past, and that's exactly what our patient history is. But we're going to try and get very specific with our patient's history and narrow it down specifically to what is it that led up to the problem today. So our purpose here, we want to obtain the chief complaint if we haven't already, and the primary problem. And then we're going to investigate it. We're going to evaluate it. So what happened to the patient and what are the circumstances that led up to it? And if it's an injury, is the mechanism of injury indicative that there could be a high-risk injury present? So what are the components of our history? Well, we start with demographic data. So this is name, age, gender, all of that stuff. The stuff like on any application you'd fill out for anything, any form you'd fill out, that's your demographic data. Then you have your history of present illness. So what happened and how did it start? We're also going to investigate the patient's past medical history. So what could have contributed to it? Do they take medications for anything? Are they allergic to anything? Have they ever had any surgeries in the past? And we're going to do an evaluation of what is their current health status. So like I mentioned, demographic data is age, gender, and race, or ethnicity, or both. The history of present illness is going to be the chief complaint and any signs or symptoms. I'm going to differentiate something here for you, and I want you to pay attention. A sign is something that we can see or something that we can verify, so like blue lips. If the patient vomits in front of us, that is a sign. However, symptoms are things that we can't really see. We can't verify. We have to go off what the patient says, like pain, nausea, dizziness. Those are symptoms. So hopefully you see the difference. I would be sure to be able to differentiate the difference between a sign and a symptom. We're also going to ask them about their past medical history, and hopefully they keep this pertinent. Sometimes patients will start in with, well, when I was 8 years old, I had my tonsils out, and then I had this really bad cold that put me in the hospital, and they had to give me IV fluids, and so I was just miserable there when I was 7 years old. Generally speaking, unless the patient is 8, a history of previous hospitalizations when they were younger for things isn't going to be pertinent to whatever's going on now, but it may be. So ask the patient if they have any medical problems or if they take any medications for anything. Ask them if they have medical history, if they've had past traumas or any recent trauma or traumatic event. So any recent trauma like a car accident or maybe a fall. Then ask them about a surgical history. Sometimes this is pertinent. If someone says they have right lower quadrant abdominal pain, one of the things that you will learn to think about is appendicitis. If the patient's had an appendectomy, then it can't be appendicitis. So with this history taking, we are going to focus in on what is their current health status as it's pertinent. So look at the environmental conditions. Is it neat and tidy? Or is it the Catwoman's house and there's no litter boxes anymore because she has 3 million cats, so there's cat poop everywhere? Evaluate your environmental conditions of their living space. And then other factors, medications, allergies, and this could be to drugs or to food or whatever. Get a list of all of the things the patient says they're allergic to. Ask them if they smoke or use tobacco. Ask them if they drink alcohol and how often. Ask them if they use any drugs or related substances. What's their diet like? This isn't are you on a diet? This is what do you eat normally? So what'd you have for breakfast? Is that normal for you? Or lunch or dinner? Are they up to date on their immunizations? And this is particularly pertinent in kiddos. It's becoming more popular for parents to choose not to immunize their kids. So it's important to ask about immunizations. If a patient's not immunized, it opens up the door to a whole host of conditions that we wouldn't normally consider in patients. For adults, have they had a tetanus shot recently? For older adults, you're kind of 60 plus, have they had the pneumonia vaccine? Oops. They came out with a new herpes zoster vaccine or a shingles vaccine. Sorry, it's shingles. So you can ask about that one too. Pneumonia, shingles, any of these other vaccines. Flu shots. Flu shots are a good one to ask about. Ask about family history. So this is going to be pertinent to whatever their complaint is. This could be heart problems, blood pressure problems, diabetes. And ask them about recent travel history. Well, it doesn't have to be too recent. In the past few years, have you been to any foreign countries? Have you been to any European countries? Have you been out on a farm in any European countries? Those are some of the questions that may come up based on the patient's condition. So what are some techniques we can use to get a history out of people? Sometimes people don't want to talk. Sometimes they'll give you yes or no answers. First, make sure you're respecting their personal space. Don't stand too close. Don't stand over them. It's more appropriate to actually be a little bit under them if you have to make a decision between, do I stand up over top a patient or do I kind of, squat down? Let's see if we can draw a little squatting guy here. Or kneel down, I guess. It's better to kneel down and be kind of below your patient, if they're sitting in a chair or something. It's better to have to look up to your patient. It gives them more of a sense of control. Watch your personal demeanor and your appearance. Watch your body language. This conveys so much information that your body language needs to show that you're open to what your patient's saying to you. Use the patient's name, so whatever name they give you, preferably Mr. or Mrs. if it's an adult, or first names with kiddos, if that's okay. Sweaty, yeah. Avoid terms like honey or sweaty. Let's make that sweetie. Gotta love autocorrect here. Honey or sweaty. No, definitely don't call them sweaty. Avoid terms like honey or sweetie or hun. Use ma'am or sir. And we're also going to use open-ended questions. An open-ended question is going to be something like, tell me what the pain feels like. That's open-ended because it doesn't give them any suggestions as to what the possibilities are. A closed-ended question would be a yes or no question. It could be, does your pain feel sharp or dull? Well, it doesn't really feel like either. So use open-ended questions as much as possible, and you may have to clarify some.